Let's do a quick overview of the psychiatric evaluation process or the psychiatric interview. So, in my mind, I have to keep things organized. So I just remember these 16 different areas. So the first one's going to be your identifying information. So name, date of birth for your patient, if they're court ordered, have a guardian, etc. Then their chief complaint, what brings them there today, what motivated them to schedule an appointment, and the goals for the appointment. History of present illness. So this is the detailed description of their current symptoms, onset, duration, severity, triggers, finding out if anything has made the symptoms better or worse, making sure to cover their sleep and appetite. Collecting your data, you want to do the psychiatric review of systems. So we're screening for mood, anxiety, psychosis, mania, the DSM-5 criteria for those diagnoses. Then one of the most important parts, their past psychiatric history. So we're going into previous diagnosis, what meds they've tried, if they've been inpatient, outpatient. Since I'm already on the topic of past mental health history, I'll then go into their substance use history. Most forms will actually have medical next and then substance use, but I flip them because I'm already on the topic. Then I go into their medical history, any medical conditions, meds they're taking. It's especially important to ask about any traumatic brain injuries since it's common for mental health disorders to occur after a brain injury. Then a quick medical review of systems just to see how they're feeling physically. Since there's a genetic component to some mental health disorders, we want to ask about their family history, if anybody in their family has mental health disorders or addiction. Into their social history, we want to find out if they're married, how their relationships are, if they have kids, current living situation, highest level of education, any legal issues, and if they had any developmental delays when they were growing up. Then we get into our mental status exam, our risk assessment, and then our formulation based on all the data we've collected is putting the pieces together. Then we're going to come up with an assessment / diagnosis. Finally is our treatment plan, so any medication recommendations, any PRNs, therapy referrals, lifestyle recommendations, lab monitoring, education, and then we go into scheduling our follow-up. There's your brief overview. I'm going to be making a series going over each component individually in detail.